It is now my pleasure to introduce Professor Ana Tercero from Spain, who is attending neurologist in the Hospital Clínic de Barcelona and in charge of intraoperative monitoring in neuro, orthopedic and vascular surgeries, and a clinical professor in biomedical engineering and medicine with degrees from the University of Barcelona in neuroanaesthesia and critical care masters from the same university. And Ana will be talking to us on the monitoring of evoked potentials during vascular surgery. Once again, please can I remind you to type your questions into the box during the talk.
So thank you for your presentation and of course for the invitation to this educational course. I'm pretty sure that maybe it's not really common to have a neurologist in your courses, but so I'm very happy to be here. So I have no disclosures for this talk. And before going in deeper into the IOM or interpretive neuromonitoring in vascular surgeries, I would like to introduce you what is IOM, just for a better understanding of its usefulness in vascular surgeries. So IOM is not a unique technique, it's a set of neurophysiological techniques or tests that you can use alone, or you can use some of them at the same time with the same machine. The goal of IOM is to prevent neurological damage before being or becoming irreversible, but sometimes we are not on time to prevent this damage, but at least IOM allows us to know which was the exactly moment that changes becomes. And if we say to the surgeons, they should be or they should know what they were doing when these changes become. So maybe we can figure out which will be the causes of this damage. And how can IOM do this? So we have two types of techniques. Maybe EEG is the most common, and maybe you will know better. And we will start with that. So EEG is a technique that allows us to know which is the spontaneous brain electrical activity in a really fast feedback. And for that, we spread out some kind of COOP electrodes, gold or corkscrew, over the scalp, following the 10-20 system. And as you probably know, in sedated patients, we will obtain or we will register a continuous EEG with slow waves and a fast superimposed rapid activity. And you can use a lot of montages for evaluating this brain neuronal function, but maybe for vascular surgeries, the best montage is this one that you can see here in the right side, that we call double banana, because this montage allows us to differentiate the lateral and medial left hemispheric brain activity from the right one in an easily way. And this is important to register asymmetries that, as we will be able to see later, they are important to detect just for knowing if there is a brain ischemia coming on. The other two techniques that we usually use for in IOM are evoked potentials, somatosensory evoked potentials, SSEPs, or transcranial motor evoked potentials. This technique allows us to evaluate the integrity of really eloquent pathways as sensory and motor pathway. And for that, what we usually do is to stim with repetitive pulses a peripheral nerve that is usually the median nerve for the upper limbs and the tibial posterior nerve for the lower limbs. So you will see this twitch but will be interested in another thing, not in these tweets. We will be interested in the potential that is evoked along the pathway. And of course, the most important will be the cortical potential, which arrives to the contralateral parietal lobe.